ONJ stands for osteonecrosis of the jaw. This is an extremely unusual complication of myeloma therapy, but is seen in some other rare clinical situations, such as when high-dose radiation therapy is delivered to the area of the jaw. The jaw bones are particularly unusual and unique bony structure in the body in that it supports the teeth, the dentition. And as a result, there are some areas that are particularly prone to loss of blood vessel supply and infection, particularly related to the teeth. We started to see ONJ, osteonecrosis of the jaw, as a complication in patients with myeloma and some other cancers who are being treated with bone strengthening medicines known as bisphosphonates. There are three main bisphosphonates used in patients with multiple myeloma. The most commonly used is called zoledronic acid. Its trade name is Zometa, but also an older drug called parmidronate or Iridia, and an oral drug called clodronate is also sometimes used in maintenance therapy. All of these, to a varying extent, increase the risk of this complication, osteonecrosis of the jaw, by preventing normal remodeling of bone at a time and place of stress where some sort of trauma has interfered with normal bone structure and allowing a loss of blood supply and local death of bone to occur. So the major risk factor in patients with multiple myeloma for ONJ is if you are receiving a bisphosphonate such as zoledronic acid, and if there has been some sort of intervention into the bones of the jaw, such as a dental extraction or significant surgical approach to the bones of the jaw. So it's important now that dentists and myeloma treating doctors communicate quite closely about treatment plans that patients with myeloma might have for their teeth. The risk of getting this is very small, but is significant enough if the complication occurs to be very alert. And there's been large education programs undertaken amongst dentists and myeloma treating doctors to ensure that they are all knowledgeable about this as a risk factor.